Hello everyone. I am Hyeon Seo at GS in Korea, and I'm gonna present about investigation on effect of TDCS through a multi-scale modeling. I think yours already knows well about TDCS, so I just briefly introduce it. TDCS is a form of a neurostimulation that uses a raw direct current that delivers to the brain area of interest. So when electrodes are placed in the region of interest, the current induced intracerebral current flow that can increase or decrease the neural excitability. In conventional TDCS, they use large rectangular patch-type electrode, and in conventional TDCS, they use more small disc-type electrode that is consisted of one active electrode and surrounded by return electrode, and it is proposed to improve the spatial focality. TDCS is able to alter spontaneous neuronal firing rate without producing action potential because the current density induced by TDCS are below the action potential threshold for cortical neuron. We can estimate the current density induced by TDCS using computational study that reconstruct the anatomy of the cortex using imaging data such as MRI. In particular, recent neuroimaging studies have helped to improve our understanding about TDCS by suggesting change in regional blood flow, neurotransmission, and membrane function after TDCS. However, in both approaches, we don't know which neural elements are excited by TDCS. Thus, the cellular basis of neuromodulation for TDCS remain an active area of research. So to know which neural elements are excited by TDCS, we propose the multi-scale modeling, which is the combination of head model and neuronal model, and it can provide the potential neuronal target of TDCS. So it is performed by combination of two steps. First step is modeling the spatial distribution of potential field using finite element head model. So for the construction of head model, we acquired MRI data from SIMNIS and then construct the surface mesh. And then attached two type of electrode. The first is disc-type electrode for high-definition TDCS and rectangular patch-type electrode for conventional TDCS. And in both electrodes, we position the electrode in the target area. In this case, we select hand knob. And then we set 1 milliampere stimulus amplitude and then solve it by finite element method using computer multiphysics. Next step is modeling the membrane polarization using compartmental analysis. For this, we adopted established model of cortical neuron that is morphologically reconstructed. Especially, we construct layer 3 and layer 5 pyramidal neuron, since pyramidal neurons are known to be primary activator of corticospinal tract and may provide main input to direct pathway. These neuronal models are consisted of a series of compartments that is connected by register. So rather than combining them directly, we position a set of center points of compartment, so we combining them indirectly. Before the combination, we selected the region of interest where is hand knob, and then positioned the neuronal model under each triangular element of cortical surface. So as shown in this figure, all the neurons are oriented perpendicular to the cortical surface, and for layer 5 pyramidal neurons, the axons are curved beyond the boundary between gray matter and white matter. And then we calculate the potential field at each center point of neuronal model using spatial distribution of TDCS-induced potential field in head model. Then by applying the potential field to the neuronal model by extracellular stimulation, we can simulate the membrane polarization in neuron environment. So here is the result. So we investigate the neuronal polarization induced by TDCS, and for this, we pointed out some specific compartment. So we picked the epithelial dendrite, basal dendrite, and soma for both neurons, and for layer 5 pyramidal neuron, we select the axon crossing boundary between gray matter and white matter, and bending part and terminal part are selected. And for layer 3 pyramidal neuron, the middle part and terminal part of the axons are considered. So we visualize the spatial distribution of neuronal polarization by projecting the membrane polarization on the cortical surface. So first, we found that the general observation that the most hypopolarization in apical dendrite and simultaneously the opposite polarization in basal dendrite and soma. And when we focus on the somatic polarization in layer 5 pyramidal neurons, we found that high-definition TDCS induce much higher peak value of somatic polarization compared to conventional TDCS, which are opposite observation compared to electric field. Since in the electric field, conventional TDCS induce about 3 times higher peak magnitude of electric field compared to high-definition TDCS. So we observe the radial field focus on the target area, since radial field have same orientation with the pyramidal neuron. So as shown in this figure, you can see that high-definition TDCS induce much higher magnitude of radial field compared to conventional TDCS in target area. And for layer 3 pyramidal neuron, we observed the consistent pattern of neuronal polarization for all the compartments. It might be due to the weak constant of TDCS that make almost uniform electric field within gray matter. Since the effect of TDCS is not restricted to the target area, especially for conventional TDCS that induce diffuse electric field, we extended the multiscale modeling to cover all area of the cortex. In this case, we only construct the layer 3 pyramidal neurons, since it is hard to find and fix the direction of the axon of layer 5 pyramidal neuron. So as shown in this figure, in conventional TDCS, most polarizations are focused on the gyral wall. While in the area directly under the electrode here and here, you can see that the most polarization is observed on the top of gyrus. In addition to this, we also investigate the impact of different morphology of pyramidal neuron. So we construct 3 types of layer 5 pyramidal neuron having different morphology. The notable differences is that type 2 and type 3 neurons have flat dendrite compared to type 1 neuron. And you also see that general observation such that hyperpolarization in upper part of dendrite and depolarization in bottom part of dendrite. And we also found that type 2 and type 3 neurons induce about 2 and 3 times higher peak value of somatic polarization compared to type 1 neuron. So in conclusion, we could simulate the compartmental specific membrane polarization using the multiscale modeling. However, the underlying mechanism of their activation is not fully investigated. So further investigation on the physical effect of brain stimulation are needed. This is my acknowledgement, and thank you for your attention.
Thank you very much, Dr. Seo. Very nice work.